Hi, my name is Angela Dingle. I'm the clinical manager for the Med-Surg unit at Medical Center, Christus Santa Rosa. We would like to invite you to sit back, relax, and watch our reenactment of a day in the life of a patient. Thank you.
Hi, good morning. Miss Stephanie?
Yes.
Hi, I'm Monica. I'm one of the charge nurses here on our unit, on the medical surgical unit. I believe my manager Angela had spoken to you earlier about us interviewing you.
Yes.
Okay, would that be okay?
Yeah.
You have some time right now? Okay,
Yes,
so
yeah.
it'll only be about maybe about 5-10 minutes at the
Okay.
most. Okay. Thank you for letting us do this. Okay, well, what we're doing is we're interviewing you about your experience as a patient here on the floor. It's my understanding you're also an employee of Christus Santa Rosa, correct?
Yes.
Okay. Well, with that being said, when you answer the questions, we want you to answer them not as a coworker of everybody else who's working here, but as the patient. So, like in the eyes of the patient,
Okay.
how you felt as a patient, not as a friend or a coworker to everybody else here.
Okay.
Okay. Okay. Well, why don't we start with when you first came to the hospital in the emergency room? Okay. So, I assume you started out in the waiting room.
Yes.
And can you describe your experience there?
It was really good. They brought me back like almost immediately, so I didn't have any sort of wait time, and so that was very nice. And yeah, it was very quick.
Okay, and what brought you to the hospital?
I have a wound and it's infected, and it's been pretty painful lately. So
There in the emergency room, were they able to manage your pain?
yes, they gave me something almost immediately for the pain. However, they weren't able to give me as much to like completely get rid of the pain because I needed additional testing. So, but
Okay.
they helped.
And can you think of any other positive experiences you had in the emergency room?
It was just all very quick. They kept me very well informed, and it was nice and easy.
Okay.
No crazy things happened.
Okay. So were there any negative things you can think of that may have happened?
Not while I was in the emergency room though. It was a pretty positive experience.
Okay. Or any surprises, like anything unexpected?
No,
Okay.
very smooth.
Okay, very good. So how long were you there in the emergency room? Like when did you get there, and when did you actually get up here to the second floor?
I got to the emergency room about 9 o'clock, and then I was brought to the floor by 3. So.
About 3 o'clock. Okay. Okay. So now let's talk about your experience here on the second floor.
Okay.
Because it's here on the second floor where we're trying to improve our processes. Okay, so you came to the floor, I assume on a stretcher, and
Yes.
you're here in the room. Can you describe your experience from then?
It was really good. Almost immediately, someone came in to do my blood pressure and everything, and then like right after that, my nurse came in to tell me everything that was going on. She introduced herself, so it was good.
Okay, and how about your pain management here while you're on the floor?
It was good. Every time I said I was in pain, they like shortly came and gave me my pain meds, so it was nice. Well, except for today, I haven't received it yet today.
Oh, okay. Did you call for the
Yeah.
pain medication? Let your nurse know?
Yeah, I've been waiting for it.
Okay. Okay, well, we'll check on that. We'll check on that in just a second.
Hi, I brought you your pain medicine. Oh, I thought my cow was in here.
Does that happen often? Have the nurses, have they been using their computers when they give you your medications?
Usually they bring them in, but today my nurse said that it died, so
Oh,
she didn't bring it in today.
okay. But when they did bring the computers in, I assume they scanned your medications and made sure they have the right patient.
Right, yeah.
Yeah, and how did you feel about that?
With them scanning it and
Yeah.
everything, and it was like reassuring. It's like, okay, I'm not getting some like John Doe's medication in the room across the hall, so
Okay.
it was nice.
Well, good. And did the nurses explain to you your new medications?
Yes, well, once again, like, except for that one time, yeah, they explained everything that was going on. Oh, well, there's one instance when I got antibiotics, when I was getting my antibiotics, and I had a really bad reaction to it, and I was like really itchy and my skin was really red, and so I called for my nurse.
How can I help you?
Hi, can I have my nurse? I'm feeling very itchy right now.
Okay, I will send her right in.
Thank you.
You're welcome. How can I help you?
Hi, my nurse still hasn't come and I'm feeling really itchy.
Okay, I will talk with her then.
Okay. And then it took a while for her to come, so I called again, and then it took a really long time for her to come. And then I ended up not getting the dosage or anything for like my itchiness until like almost 2 hours. I think it was like at the end of her shift. Oh, and then later on that night I received the antibiotics again, and then the same reaction happens with like me itching and everything. And so other than like with the antibiotic, everything was pretty much explained to me, like the side effects and everything, minus with the antibiotic.
Okay. Well, that day, like after you got the Benadryl, did the nurses come and do bedside report, and did they explain to you, or did they explain to each other about what had happened with the itchiness?
Yeah, when they came in, I was basically knocked out, so they don't really, there's no communication about what had happened, really. So, yeah, because I was completely knocked out almost from the Benadryl.
Oh, okay. All right. Okay, well, again about bedside report with the nurses. Did they ever do bedside report while you were here?
Yeah, they did bedside reporting.
Oh, okay. And when they did come in to do bedside report, did you feel included in the conversation, or were they just talking to themselves, or was it a team effort?
They were kind of like just talking to themselves, but then I would just like throw in my 2 cents. So it was pretty much just between the two of them.
Okay. And how did it feel like when they came in to do bedside report? The whole experience of bedside report.
Kind of felt like they were like talking over me, so I was just like, oh hey, like let me say something.
Oh, okay. Alrighty. I noticed she wasn't wearing her gown, and you were in isolation. How does that make you feel that your nurse isn't wearing her isolation gown or gloves or anything?
Kind of concerning. Like it's all germy, and then it's just like, what are you bringing in? What are you taking out with you? So
Yeah.
I don't know. Makes me a little bit nervous, for her at least.
Yeah, it makes me nervous too. Okay, so in regards to dietary, ordering food, can you describe your experience with that?
Overall it was good, except for the first day. I like placed my order, and then it was like a really long time, and so I was just sitting there waiting for it. And then I called in to check on it to see like why my food hadn't come yet, and they said it was like on the bottom of the stack or something. And so, but then after that, they like brought it right up, and then after that, it was like smooth sailing. So
Okay. And how would you describe how the experience went? You know, as far as like, how did you feel about everything?
as far as the food, or
Yeah, about the food, and then also just about that first day, you know, when they forgot your food.
it was a little irritating, but I mean, the fact that they brought it straight up afterwards was, I don't know, I guess reassuring. So it was a good experience overall.
Okay, very good. Oh, I have another question. Let's say compared to other hospital visits that you may have had, how would you compare this hospital visit?
It was really good compared to other places. Like I was at another hospital before, and they were really busy, so they kind of like overlooked me, especially since they knew I was an employee. So it's like everything I had to do for myself. I felt like when it came to like taking a shower, or, like changing the bedding and everything, it's like they kind of just like, oh, you know what you're doing. So they like left it all to me. I'd like to take a shower and change my cover.
Okay, the linens are that way. You just take the one step and then go right there on your right.
Okay, and how did that make you feel?
It was not, I don't know, it was not a good experience. It was just like, well, even if I am an employee, I'm still a patient. Like, I'm here for a reason. I'm supposed to be taken care of.
Yeah.
So it's just like, I felt very overlooked and just not taken care of at all.
Okay. Okay, so in regards to your whole experience here, can you think of any positive experiences? Anything that really stuck out, like people you might want to recognize?
The night shift CNA, especially when I was taking the Benadryl, she would like come in, like wake me up, make sure like everything was okay with me, like make sure I was taken care of. And then also the day shift CNA, she was really good. She came in and made sure everything was good with me, that I had everything I needed. So those two definitely.
How can I help you?
I'd like to take a shower now.
Okay, I will send in your nurse.
Thank you.
You're welcome.
Hello. Hi. I'm John Alonso. I'm one of the CNA here at the hospital. I heard you called that you needed a shower.
Yes.
Okay, I'm here to help you. I got some towels for you.
Okay, perfect.
Where do you want me to put it? You want it in the bathroom?
You can just put them on the end of the bed. That's work.
Okay. Do you have an ID with you? Do you have an ID access?
Not right now.
Okay. All right. So when you go in the shower, when you get up to the shower, I'm gonna change your bed while you're in the shower. Okay?
Oh, it's fine. I can do it.
No. It's my job, so I'm here to help you. So you just relax and just take a shower. Okay?
All right.
All right. Anything else I can do for you right now?
No, I'm good.
All right. You got your call light on. Just call us if you need anything. Okay?
All right, thank you.
Thank you. Hello, Miss Stephanie. It's John, one of the CNA. Can I come in?
Yes, of course.
All right. How's the shower?
It's good.
Pretty good?
Yes.
I'm just making my rounds. Do you need anything right now?
No, I'm good.
You doing okay? You need any water, cracker, peanut butter?
Okay.
All right, so let me check with the nurse. If you need anything else, then I'll be back and check on you again, okay?
Thank you.
Thank you.
And how did that make you feel as a patient?
It made me feel like I was like being taken care of, that I was being looked after, that like they actually cared, and that I was more than just like an employee to them. Like I was being actually taken care of. So it was nice.
Oh, okay, good. Can you think of any negative things that may have happened during your stay?
No, it was pretty good overall. Yeah.
And while you were here on this floor, do you think of anything that was surprising? Anything unexpected happen?
No, I was kept pretty well informed. So.
Oh, good. I'm really glad to hear that. Okay, and I think that's all the questions I have for you. I'd like to thank you for taking the time to answer my questions and to share your experience as a patient here. This information is definitely going to be very valuable to us in trying to improve our unit and the experience for our patients here. Okay. Thank you.
Yeah.